Coming up next, a non-invasive way to check your health. Support is saying no other screening tool can match thermography for its ability to track inflammation. That's up next on Long Island Naturally. Hi, welcome to Long Island Naturally. I'm Mary Mucci. It's now becoming more widely accepted that inflammation is the precursor to many chronic diseases like Alzheimer's, cancer, arthritis, and heart disease. So what if we could see these coming? Well, some doctors say we can with digital infrared photography, otherwise known as thermography. They say thermography is non-invasive and completely painless. Also, that it has no side effects and can track your progress to better health. To find out how it's being used here on Long Island, I visited the Integrative Healing Center in Port Washington and filed this report.
It's good, and then just come back this way. Wonderful. It's the only camera you don't have to smile for.
But despite her sinus headache and jaw pain, Michelle Vespi found herself smiling anyway.
I'm not crazy that this pain is real.
Michelle is excited she found out about thermography. This digital infrared camera detected the areas of increased inflammation in her sinuses and jaw, all without any radiation exposure.
So we can look for inflammation in any given area of the body. And that's really what the camera's picking up, is inflammation.
Experts say thermography offers an entirely different approach to health care because it can catch disease in its early stages. That means there's still time to make the kind of lifestyle changes that can help reverse it.
Put your hands over your head.
Pam Calderon found a new way to screen her breasts when she took a job here at the Integrative Healing Center.
Can you come in tomorrow at 12?
Pam's been suffering with fibrocystic breast disease, and for years that meant mammograms every 6 months. Now she's delighted to learn she can help heal her breasts, and she's relieved she can track her progress without exposing herself to radiation.
It's very nice for people to see the before and the after, to be able to see what they've actually done to heal their body. And it does show up in the pictures.
So it's really exciting. They get to feel empowered about their progress, and we get to see that they're improving.
It was very interesting, very informative, and not painful.
I think it's pretty amazing.
Coming up on Long Island Naturally, how thermography can help you on your journey to health. We'll be right back. Hi, welcome back to Long Island Naturally. Our topic is thermography, and our guests are Kristine Blanche, the founding director of the Integrative Healing Center in Port Washington, and Dr. Danielle Roberts. She's an osteopathic physician with a master's degree in clinical nutrition. Thank you both for joining me.
Absolutely.
Kristine, thermography is still relatively unknown, so why did you want to invest in it?
Well, when I opened the center, Integrative Healing Center, back in 2008, it really was one of my founding missions that we be a bridge between conventional and holistic medicine, because I think there's tremendous value in both. And the thermography has been a great tool to facilitate that, because it brings an objective picture to our patients, which is what they're used to seeing. They're used to their CAT scans and their MRIs. So now we have a tool where we can take a picture and we can show them the objective measure what's going on in their body. And it's been a wonderful tool for them to really to see what's going on, and for us to show how they're getting better and have a marker for that improvement. So it's been
Okay,
really
so
wonderful.
explain to me how it works. It looks like just a brightly colored photograph.
Sure. Well, it really is just a camera. You sit and you take a picture, and the picture actually picks up heat in the body. So we see areas of red, white, blue, and that's the contrast of temperature within the body. So we can see inflammation before it's there, frankly.
Okay, well, we have a picture of a healthy thermogram of a woman with healthy breasts. And tell us, what is it about this that says that she's healthy?
So you'll see there's different colors. There's the blues, the greens, the yellows, and the reds, and white. White is the hottest part of the body, and then there's red. Now this breast looks perfectly normal. There's no areas of concern on that breast that I would bring my eye to.
Okay, and the fact that they're symmetrical, isn't that one of the issues?
Yeah, we compare left to right, and we are looking for asymmetry. So if there's an area in one breast that's concerning, we're going to see it when we do that comparison, and that's how I show the women what we're looking for as well.
Okay, and we have another graphic which shows a woman who has what's known as the ductal carcinoma in situ, which is a non-invasive breast cancer, and that's where the arrow is, correct?
Absolutely, and that's a great example where we can compare. We can show the women the difference between the right and the left breast in our area of concern, the area we want to really pay attention to.
Now, what the picture is picking up on is heat, right?
Correct.
So why is heat significant?
Heat represents inflammation, and it also can represent new blood flow to an area. So before a cancer develops, you need increased circulation to feed those cells to allow them to grow. So that's why thermography is a wonderful tool, because you can see the inflammation. You can see something starting to brew 6 to 8 years before you're really going to maybe have it show up on mammogram or have it be palpable on exam.
Now, Dr. Roberts, is heat or inflammation something people can feel?
If they're tuned into their body, they can. But many of us are very disconnected from our bodies now. Certainly, if you have abdominal pain, that's inflammation. If you've got a pulled muscle or you've got chronic back pain, there's chronic inflammation in that area. So pain is very equivalent to inflammation.
Okay, who reads these thermograms, Dr. Roberts? Do you? Who reads them?
Currently, I don't. We actually send them out to radiologists who read these and do nothing but read these every single day. So therefore, their eyes are much more sensitive to any types of asymmetry that may be going on in the pictures.
Okay. Kristine, is it true that a thermogram can tell us exactly what's going on, or could it be that the person's just having some, I don't know, an infection, for instance?
Sure. It's a tool to see areas of concern. So it's going to bring, as a practitioner, it's going to bring my attention to a certain area. If you have an infection going on, for example, sinus infections is something we see right away. Dental infections we see right away. That's going to tell me, hey, and I really do have to speak to the patient and say, is there something going on in that area? I may even need them to go to the dentist and bring the thermogram to really get the dentist tuned into that one area to do some, it's detective work. It helps guide us in our detective work, really.
Okay. I understand thermography has been approved by the FDA as an adjunct screening tool. What exactly does that mean?
Well, there's different diagnostic tools. So you have your mammogram, you have your ultrasound, and you have your thermogram, and they all have different statistics on how fine-tuned they are, how sensitive they are. You have those statistics that we were just talking about.
Yeah. In particular, mammograms are approximately 80% sensitive. As you age, above age 50, that sensitivity drops to about 60% sensitive. Thermography is about 90% sensitive, and ultrasound is approximately 83% sensitive. So again, none of these tools are 100% sensitive. They're all adjunctively working together to be able to detect an early cancer. Biopsy is the only way you're really going to diagnose. That's the gold standard. The only way you can really diagnose if it's actually cancer is by biopsy.
Now, Dr. Roberts, what if you have a woman who doesn't want to have a mammogram? What do you say to that?
Well, I think that now we have a fabulous tool to be able to offer her. Mammograms can be painful, and they also emit radiation. Every single time a woman goes to get her breasts screened, she's receiving something that may contribute to a future cancer. So for us to be able to offer a screening tool that's safe, that does not influence or does not increase her risk for further risk for cancer, now we can use that tool not only to screen her, but if she does have fibrocystic breasts or there is some heat in one area or another, and it's not necessarily a cancer or precancer, we have a tool to implement change, because now she can see what she started at. She implements some lifestyle change, which for some people is very difficult to do, and we can show her 3 months later that she's really made an impact in her health. She's really made a change. So she's going to be much more motivated to continue that change, and that's really priceless.
Wow, I agree. I agree. But the fact that it's an adjunct tool and it's approved by the FDA, does that mean it's covered by insurance?
We actually are getting pretty good reimbursement for our patients.
Oh,
a
great.
lot of insurance are now starting to cover this. There are procedure codes and diagnostic codes, and the patients are starting to get reimbursed. Again, it's insurance dependent, but I think that's a very positive sign that insurances are starting to reimburse for this test.
Okay. I have a clip from the Mayo Clinic stating that thermography is not good at detecting small tumors and tumors that are deep in the breast tissue. What do you say to that, Dr. Roberts?
I'm a little bit confused as to where that claim came from. I mean, we just talked about sensitivities of each test, and Kristine also touched on the fact that a small cluster of cells is going to need further blood flow and increased vascularity when it's just a tiny, tiny little bit of cells. So mammogram, you're going to need a lot more cells because it's just a structural exam. You have to be able to see a mass of cells on mammogram in order to be able to detect it. Thermography, all you need to know is that there's a few tiny little cells that need increased blood flow in that area, and we can detect the blood flow and the inflammation on the thermography. So, I mean, up to 8 years sooner than mammogram can. So I'm not exactly sure where that fits in.
Okay, well, there's some resistance apparently. We need to take a break, but we'll be back with more on this new kind of health checkup, so please stay tuned. Hi, welcome back. We're continuing our discussion on thermography as a screening tool for all kinds of chronic health problems. I'm here with Dr. Danielle Roberts and Kristine Blanche of the Integrative Healing Center in Port Washington. Kristine, for some people this may be the very first they've heard that thermography can be used for something other than breast cancer detection. Give me an idea of some of the things that you've been using it for.
Sure, absolutely, Mary. You know, there's a full body, there's a range that we can just do one body part with the breasts all the way up to a full body and everything in between. So there's a women's panel, there's a men's panel. The head and neck is very telling. We see a lot of sinus inflammation. In the neck we can see carotid artery disease.
Really?
So if there's a lot more inflammation on the right than the left, then we're going to have to look at that patient's risk factors and say maybe we need to send them for a carotid duplex and find out the measurement of what's going on in that carotid as far as blockage goes. I think that as physicians and practitioners, our time that we're allowed to spend with patients, the doctor's time spent, has been diminished. So a lot of the physical exam, very commonly I'll listen to patient's carotid artery and the patient will say, "What are you doing that for? Why has nobody ever done that to me?" And that's the physical exam portion of how to tell if you have a concern in the carotids. So shorter patient's time, shorter exam, and these tools are very valuable because then we can screen and we can say, let's send you for a carotid Doppler. Let's look and see at that carotid artery before there's a stroke or a TIA or something serious like that.
Okay, might it also prevent someone from having to go for more invasive tests?
Absolutely. Very frequently I have patients come in that have been to, several physicians, really not feeling good, but not getting the answers. And they'll come in and just recently I had a woman who, when I showed her all the inflammation in her body, she broke down into tears because it was really the first time that there had ever been objective proof of what she was actually feeling in her body. Now she had had MRIs and CAT scans and nobody could really pick that up for her. So it was very validating because you start to feel like, hey, maybe this is in my head. So that was a really powerful moment for that woman, really exceptional.
Actually, we have a graphic of a man who spent 3 years trying to figure out why he had leg pain. Turned out he had phlebitis.
Sure.
And here it is.
Yeah.
And I guess, does the yellow indicate anything or is it just the red we're looking at?
It's all inflammation. So you can see the blue is kind of normal for this gentleman, and you can see the yellow, the red, and the white are areas of inflammation, the white being the hottest. So that was probably the highest point of intensity right there. And that is a really good example of inflammation within a blood vessel. It's similar to what we would see in the carotid arteries. We can even see decreased circulation to the extremities in diabetics and people with conditions like that. So it's very valuable.
Dr. Roberts, I went on the internet to see what the quackbusters were saying, and they were saying that digital infrared photographs can't see inside the body, so how can it possibly screen for something like heart disease?
Well, I think that it looks at the physiology of the body instead of just the structure and the anatomy. We're actually able to see the function of the body, so where the metabolism is working, where the blood is flowing, and that's going to give us much more insight besides just the structure that's there. So again, if there's inflammation in the body anywhere, I mean, as an osteopath, I was trained to use my hands on different sections of the body. So if I picked up heat in any particular section with my hand, I was taught that that's a place of increased inflammation. So if
You can actually feel it with your hand.
Oh yeah.
Really?
But
wow.
that takes time and training. Now we have a tool that can pick it up with much less training, so there's other physicians that can use that. And if they find inflammation around cervical, the thoracic vertebrae of T2 to T7 or so, they're thinking maybe maybe there's a little feedback from the heart coming to the vertebral system, and then we know to look further into the heart or the lungs for where a potential problem might lie.
Mm-hmm. I was particularly impressed by your associate Pam's story that she had been going for mammograms every 6 months for years and years and years because she had fibrocystic breast disease.
Yeah.
And it seemed like such an extreme measure.
Yeah, this is not the first case of that. I just had another patient land in my office this week and say, oh yeah, I've been getting them every year since 5 years ago when I had a lymph node that was found underneath my arm in the axilla. And a lymph node could simply just be increased inflammation draining from the body, a little bit of lymphatic drainage, some dietary changes, and that lymph node easily recovers. But now she's been exposed every single year since then getting mammograms.
Well, I know Pam said she wasn't going to be doing that anymore. She said she was just going to be going for the thermography to see her progress. And isn't that the idea, really?
I mean, the fibrocystic breast disease, I think, is one of the most pertinent examples of how powerful thermography can be, because when women come in, they may not even be aware that there is an issue going on in their breasts, and we see this pattern that's consistent with it. And then we educate them when we have them get good vitamin D and anti-inflammatory herbs, shift their diet, maybe detoxify, and they come back 3 months later and they see the change they made in their breast. Adding iodine can be a profound tool for patients who have fibrocystic breasts, and then they know they've done something. They've done it, reduced their risk for breast cancer, and it shifts it from fear, which I think a lot of women go into their yearly mammograms afraid. Anybody who grew up on Long Island has this little fear in the back of their mind, but we try to take that fear and shift it into empowerment, and really use that tool to say, hey, look at these small changes you made, and look at the change you made in your body, and you have, without a shadow of a doubt, decreased your risk for breast cancer. Yeah. That's powerful for women. And then they kind of go, I did that? Okay, I can do this. And they just keep going, and it's really, really, really wonderful.
Yeah, there's a really powerful study actually. I found out through Kristine Northrup, who's a distinguished obstetrician and gynecologist. 40%, they did an autopsy study of women who were in accidents, young women. 40% of them were found to have ductal carcinoma in situ. But we know that 40% of our women don't wind up with ductal carcinoma in situ. So the body has an innate ability to heal itself. We're missing that. We're living in this place of fear on a daily basis. And
I'm sorry we're out of time, but yes, I agree with you. Yeah. The body can heal itself, and I think that's why we're doing this show. Okay, thank you so much for joining me, and thank you for watching. Please tune in each Wednesday for my weekly reports on integrative medicine and natural lifestyle choices. For Long Island Naturally, I'm Mary Mucci. Enjoy the rest of your weekend.